Hi, my name is Alejandro. I'm going to be doing a couple of assessments on your lumbar spine and your pelvis. We're going to start with lumbar flexion. So stand up, please. I'm going to place the fulcrum on your iliac crest, just right here. And then I'm going to line it up between her ASIS and her PSIS. So I'm just going to find that real quick. Over here. Okay, and then the moving arm is going to line up with her axilla. And then you're going to bend over as far as you can go. Okay, adjust for her movement in her hip. And then down. Alright, and then come back up. Alright, and then she is at 100. And I looked before she bent over, she was at 160. So she's at 60 degrees of range of motion, which is normal. Okay, so for this test, we're gonna do passive range of motion of your right pelvis bone. Alright, so I need to scoot forward to the end of the table. And then bring your shoulder to the table. Alright, and then I'm gonna grab your bottom leg and hook it around my waist. Okay, and then I'm gonna bring my forearm and put it on her PSIS, and then hook my arm around her leg and intercross my fingers, and then I'm gonna bring you to anterior rotation by pushing your leg back. Is that okay? And then I'll bring you to complete range of motion. All right, and then you can relax. Okay, so now we're going to test the other side because you have to do it bilaterally. So go ahead and bring your chest on the table again. And then I'm going to grab this leg and hook it around my waist. Okay. Put my forearm on her PSIS. Then hook around and then bring her into anterior rotation. And then mass passive range of motion, and it feels the same on both sides. Alright, relax. Okay, so now we're gonna perform a manual muscle test, and for your lumbar rotation. So I want you to try to bring your right shoulder to your left knee with your hands on your side. Okay. And that is a grade 3 because she lifted both of her scapula off the table. And now she's going to do the same thing, bring her left shoulder to her right knee to test bilaterally. Okay? And we're testing her external and internal obliques, which are responsible for rotation. Her external oblique is opposite on rotation, and her internal oblique will flex to the same side she's rotating to. Okay, so now we're going to perform a special test called the squeeze test to see if she has any misalignment on her pubic symphysis or tubercles. So I want you to bridge up and down, and then pull her legs quick, and then come back up. This is to make sure she's in neutral position. Then I put my hands in between her knees. I'm going to ask you to squeeze slowly first, and then squeeze a little bit harder and harder. Do you have any pain with that?
No.
Okay, relax. So this test has a high sensitivity test, which means it's good for ruling out if she has any sort of problems with her pubic symphysis, which she doesn't because she doesn't have any pain. Okay, so now we're going to perform the last special test, which is called the slump test, which is going to test if you have any disc problems that might be causing any nerve problems on her leg, any tingling sensation. So I want you to hunch over, and I'm going to put a slight pressure on her back. Does that bring any pain?
No.
Now bring your head down. Does that bring any pain?
No.
I want you to lift your leg up, please. Does that bring any pain, tingling?
No.
What about when I actively or passively bring your foot into?
Yes.
Yes, okay. And then I'm going to test the other side. Come back up again. Hunch over. Does that hurt?
No.
Bring your head down. Does that hurt?
No.
What about when you bring your leg up?
No.
And then, what about when I bring your toes up?
Yes.
Okay. So she tested positive. She does have Facet syndrome, so that could be a reason why she has tingling down her legs. This test has a high sensitivity, which means it's good for ruling out radiopathy or any issues with her intervertebral discs. So now we're gonna do the palpation of her inguinal ligament. So first, is it okay if I touch you? I'm gonna find her pubic bone. We're bringing my fist down until I feel a little hard end stop, which is where her bone is at, her pubic bone. And then I'll come up and find her ASIS. And now I'm gonna palpate between her ASIS and her pubic bone, which should be her inguinal ligament. And you should kind of feel like a band, tight band between those 2 points. And then we'll do the other side. Find her ASIS again, pubic bone, and then just this. And it should feel like a tight band, which it feels fine. Okay? So now we're gonna do the palpation of her quadratus lumbar muscles, which are more, is it okay if I let you show? They're gonna be more lateral than the longissimus muscles. So right about here. And then I want you to put your hands behind your head. And just to make sure that I'm actually on the muscles, I want you to try to lift your body up. And then flex side to side. Okay. And the side that she's flexing to, the muscle should get tighter on that side. Alright? Alex?